Anxiety disorders affect approximately 32% of adolescents and teens, making it the most common mental health issues that teens face today. Hi, I'm Dr. James Thatcher. I'm a child psychologist, and I know firsthand how having effective parenting strategies can help your teen be able to deal with their anxiety. So today what I want to do is I want to go over some evidence-based strategies that you can use with your teen in order to help them. How we're going to go about that is I'm going to discuss what does anxiety look like in teenagers, and then I'm going to talk about 8 different ways that you can help your teen with their anxiety. So let's jump into it. So adolescence or being a teenager already means that there's going to be built-in stressors. So where they're going through things for the very first time, they're dealing with relationships, they're dealing with difficulties. But then when anxiety starts to become so extreme that it's impairing their abilities to function, that's when it becomes a problem. Untreated anxiety can lead to academic difficulties, social isolation, substance use, and even depression. So, how does anxiety present itself in teenagers? So, it can present itself as excessive worry. You'll hear this. They're worried about school, or I'm worried what's going to be happening the next day. What's this test going to look like for me? What are these people going to think? So, persistent worrying about things. It can also manifest itself as physical ailments or physical symptoms. So, lots of stomach aches, headaches, aches and pains. Also, sleep disturbances can happen. Usually, it's going to be difficulty falling asleep because their mind is racing so much and thinking about the next day or what happened that particular day that they can't fall asleep. And even if they do fall asleep, maybe they wake up in the middle of the night. It's hard for them to fall back asleep. You may also see them avoiding anxiety-provoking situations. So if a big test is coming up the next day, they may be sick. Or maybe if there's a lecture going on the very next day, again, maybe they're trying to get out of school. Sometimes it can also look like perfectionism or a fear of failure. And also sometimes in teenagers, anxiety can present itself as being very irritable or just having anger outbursts now and again. So now I'm going to get into the different strategies and ways that you can approach anxiety, but I want to preface these different ways with this to where I'm going to speak in very general terms. To where if your teen is having severe anxiety, I strongly encourage you to go find a mental health therapist that works with children and adolescents and teens so they can have a much more tailored approach. The ones that I'm about to discuss, even though they're evidence-based, your teen is going to need someone to open up to, talk with, and have a much more tailored approach to dealing with their anxiety than what I'm about to talk about. That being said, these strategies are meant to help you approach things from a different way, conceptualize things a different way. That way, you can still help your teen significantly in dealing with their anxiety. Number one is validating emotions without reinforcing avoidance from our feelings. So, what is validation? Validation means that you're trying to understand where your teen is coming from. And this is crucial for teens. So, if you approach them to where you're not judging them or dismissing their concerns, rather from an angle that you're getting curious about what's happening, they'll be able to open up with you. And in doing so, be able to process through some of their anxiety. So, how can you go about this? You can use some reflective listening. For instance, so I hear that you're having a hard time with this test coming up. What I want you to do is to avoid dismissive comments. Oh, well, you shouldn't be worried about that, or there's nothing to worry about there. You can just move on. Please don't do that. That's very invalidating for them. And they're not going to want to open up to you if you do or say something like that. You can also acknowledge the difficulty in it while also projecting confidence. I see that this feels really hard for you right now, and I still think that you can handle it. And what this also means is what I need you to do is to separate validation from accommodation. Validation, again, is getting curious and trying to understand where they're coming from. we still want them to experience anxiety to where they can gain experience and a level of mastery over it so that they know that they can accomplish it next time. If you stay to the end of the video, I'm going to make sure to put a link to the other video that I have that goes in depth into not just validation, but something called active listening that can improve relationships. So please go ahead and check that out. Number 2 is encouraging gradual exposure to anxiety-provoking situations. So what does that mean? So cognitive behavioral therapy indicates that gradual exposure, so being exposed to the fear stimulus a little bit at a time, can help with our anxiety. So let me try and give you an example on what that means. I worked with a patient a while ago to where they were afraid of escalators. So the escalators at the mall, escalators at department stores, deathly afraid of them, wouldn't go on them, would take the stairs instead. So how do we go about that? So what I first did is develop what's called a fear hierarchy, and it also might be called a fear ladder, to where you get an idea of what they're afraid of and what level that is. So for this particular person, we started at one being the least amount of anxiety. So 1 was just being at the mall. That was the lowest level of fear, all the way up to a 10, which was getting on the escalator. What we did was gradual exposure to where I would have her go out to the mall and just be there, evaluate her level of fear, and at the same time, she's using coping skills. And I'll get into some of those here in a minute. And little by little, she would become more exposed to the fear stimulus, be more exposed to the escalator. A level 3 on that ladder was walking up to it. And a level 7 was putting her hand on that conveyor belt where your hands go as it go up. And of course, 10 was like getting on it itself. So a little bit at a time, we get her closer to the escalator, eventually have her hand on there, use some deep breathing, some other coping skills. Again, I'll get into that here in a minute. And then eventually get on the escalator. And she was able to face her fear and deal with it. And a couple things to keep in mind with this is that you want to encourage and celebrate courageous behavior. Any small steps that they may make, you celebrate that. That's what you want. We're not going for the perfect outcome to where they just deal with it within one day. No, this is going to take some time. So any movement, even small, celebrate it. Number 3 is teaching relaxation techniques to them. So I'm going to give you a couple of examples. Diaphragmatic breathing. What does that mean? It means taking a deep breath in through the nose and slowly out. And ideally, the in breath being about 5 seconds and out breath being about 7. When you breathe out slower than when you breathe in, you're telling the body that there's no threat around. If it's taking you a long time to exhale, it's basically telling your adrenal gland that there's no threat. Because why take a nice deep breath and breathe out if there's not a giant tiger around or a bear? And in today's modern worlds, tests, a crush that's around, or other kids that are judging you. Those are the fear stimuluses nowadays. Another one is called progressive muscle relaxation, or PMR. So what does that mean? That's where you progressively relax your muscles one at a time. And you can do this several ways. With little kids, you can like squeeze lemons and relax. Squeeze the lemons and relax. Or you can go through each muscle group one at a time to where you clench up your feet, relax. Clench up your thighs or your calves and relax. Clench up your abs and your chest and relax. You get the point. Another couple of ones are some mindfulness techniques that you can use with teens. There's lots of videos here on YouTube. If you guys are interested in me making a mindfulness-based video, I am more than open to it. Please put a comment down below and I will. Other ones could be guided imagery to where you're imagining or having your teen imagine being in a relaxing place, like walking through a forest. And the trick to that one is using all of your senses. So, what does it look like? What does it smell to be out there in the forest? Or maybe a relaxing scenario for them is by the beach. So, imagining that their toes are in the sand, or that the beautiful blue ocean is crashing in and coming out. You can hear the sound of the ocean. You can see the beautiful blue waves. You can smell the salt in the air, using all of your senses when you're using guided imagery. And another thing that you can use is exercise. So sometimes with anxiety, you just kind of feel like this on edge, built up, pent up energy that's in you, and you just got to get it out. And I have anxiety. Lots of people have anxiety. In fact, pretty much everyone in the world has anxiety. So, how do you deal with it? How do I deal with it? I go on walks, I exercise. Sometimes with teens, they need something kind of intense to get that energy out, like doing a bunch of push ups or jumping jacks or going for a run. All of these things can help with anxiety. Number four is having a healthy sleep routine. All the research shows that when teens gets a good night of sleep, they're going to be much less susceptible to anxiety during the day. So what does this mean? So that means creating some sleep hygiene. So that means no electronics an hour, if not ideally 2 hours before bed. This means no caffeinated drinks after 12. This means creating a consistent sleep and wake time, all within 30, sometimes 60 minutes of one another. So, not going to bed 11 o'clock one night, and then the next night you go to bed at 3 in the morning. That's going to throw off that sleep wake cycle. Another thing is to work with the environment in the room. So, keeping it dark, keeping it cool, keeping it very comfortable and relaxing. If your teen is doing a lot of homework on their bed, try to get them out of their bed to do their homework at the kitchen table or a desk in their room. When teens are sitting on the bed doing their homework, and then an hour or two later, when they lay down in bed, their mind is started to associate, especially if they do this day after day after day, their mind is going to associate the bed with homework versus a place to sleep. So you want them to get to associate homework with the desk or the kitchen table or somewhere more appropriate versus the bed, which should just be for sleep. Number five is developing what's called cognitive restructuring skills. What does this mean? There's common thinking mistakes that human beings do, and I'll just give you a couple of examples like catastrophizing, other known as fortune telling. There's another one called all or nothing thinking or black and white thinking. So, with catastrophizing, that is just thinking of the worst thing that could happen, right? For instance, is if I tell her that, she's going to hate me forever. Or a black and white thinking mistake is if I don't get 100% on this test, I am a giant loser. I would have failed. How do you deal with that? Well, you need to give perspective. So, asking them some questions to help them figure out that this isn't quite balanced. Let's go back to that scenario to where they said that if they say this thing, then she's going to hate me forever. Well, what evidence do you have? How do you know that? How do you know she's going to react? Can you tell what other people are thinking? I didn't know that you could do that. And sometimes I'll be that sarcastic in the room, especially if I know the teenager very well. And it kind of depends on your teen. Do they respond to sarcasm like that? And if not, don't use it. But if they do, be humorous because what it forces them to do is examine their perspective on it. Wait, that is ridiculous. And another thing to do is to model healthy thinking patterns yourself. I guarantee you, and I'm guilty of this too, pretty much everyone is having those thinking mistakes pop up for us as well. So being able to realize it, become aware of it, and then do something about that and model that for your teen is going to be huge. So number six is balancing support with autonomy. So all the research suggests is that having teens being supported in a healthy, appropriate way while also allowing to be autonomous and making mistakes and learning from those mistakes is what's going to help them grow. Finding a balance between these things can actually help them lead to becoming more independent in the long run. What you're going to do is you're going to collaboratively work with any sort of things that are happening with their life instead of rushing in and fixing it. Please stop fixing the problem. Collaborate with them, help them think it through, ask them questions, get them to think, because the idea is not to fix all the problems for them, because that's not what's going to happen in adulthood. It's to help them become critical thinkers and independent so they can think through these problems on themselves or by themselves and seek support from other people when they need to. Some other ways that you can do this is gradually increase the responsibilities that they have around the home. Another way is to maintain open communication versus intrusive questioning. So, an example of this is letting them know, I'm here if you want to talk to me. I will listen to you whenever you're ready to talk to me, versus, what's wrong? Something is wrong with you. You need to tell me what's going on. One is being open, and hopefully they will eventually come to you, versus badgering them, which might make them want to pull away. So, number 7 is creating predictability while also building in opportunities to be flexible. So, a very common issue that is seen with anxious teenagers or anyone who's anxious is needing to be able to predict what's going on. If you have control and know what's going to happen, like at X time, I'm going to do this, and at X time, that person's going to do that, and have like a routine, that's going to drastically decrease your anxiety because that's just one less thing to worry about, right? So finding a balance between those things to where creating a routine where it can help with their anxiety go down a little bit instead of everything just be kind of chaotic and all over the place. And creating small opportunities for things to be flexible. For instance, could be maybe you head home right after school when you pick them up, but an opportunity could be like, hey, today I need to run this errand to the store. Is it okay if we do that before we go home? And another way is to have discussions with your teens that life is unpredictable. You're not going to be able to foresee everything that comes your way, and normalizing that for them. Because again, this is the first time that they're going through some of these issues, so they just might not be aware. Number 8 is seeking support when it's appropriate. The evidence is clear that when teens get professional intervention, that they have much better outcomes in their anxiety. So how can you go about this? I would strongly encourage parents to have their teen involved in this decision making as much as possible. So talking with your teen about getting a therapist, having them involved in the process. I can't tell you how many times that here at the clinic or just me professionally, I've had a parent, and luckily this doesn't happen all the time, but it does happen. Parent reach out and want therapy for their teen because they're anxious or depressed or what have you. And at the end of the consultation, I find out the teen has no idea. And the parent will ask the question, well, how do I bring this up with them? And in my mind, I go, you haven't talked with them about this before? You need to have them a part of it because they're the ones that are going to have to do all the work. They're the ones that are going to have to go to therapy and open up and discuss these things. So you need their buy in to it. They need to be a part of this decision. And I would strongly encourage that folks consider evidence based therapies like cognitive behavioral therapy. Because what evidence based therapy means is that it's been proven time and time again to be effective with specific mental disorders like anxiety. And another thing to consider is addressing your own anxiety. It's very common for when parents are anxious their kids get anxious too. And maybe you would have seen that when your kid was younger, to where if you were more stressed out, there was more tantrums that were going on. They were more stressed out, more on edge. And it's going to be the same thing as a teenager. If you're in a home environment with someone who's very stressed out, you're going to be stressed out too, because you're so connected and love that person. Looking inside of ourselves and seeing, am I anxious right now? And seeking help for yourself also help your teen. So, in conclusion, supporting a teen with anxiety takes patience, consistency, and a willingness to not only comfort, but also to challenge them. And by implementing evidence based treatments, the ones that I just discussed, this is going to help build resiliency to all the unpredictability that's going to happen in life. And this is going to serve them throughout adulthood. And one last thing to keep in mind is that this is not going to change overnight. This is going to take a long time. Their anxiety probably took a long time to develop and manifest and become this significant. And it's going to take a long time for them to practice these skills and use these skills in order to bring down that anxiety. And remember, we're not getting rid of anxiety. In fact, you don't want to ever get rid of anxiety. Anxiety can serve a purpose. All human emotions serve a purpose. And with anxiety, it's a signal that we need to pay attention to, right? So if our teen is getting anxious about taking a test, well, where is that anxiety coming from? It's likely coming from that I need to do well on this in order for me to graduate high school and go into college and have a good career that I want. So having a little bit of anxiety to where it's not so debilitating that they don't do it or freeze up, but a little bit of anxiety to where I need to study for this, that's going to make them consider, oh, I do need to study. That way they do well on the test. Anxiety is a protective emotion for us. It only becomes clinically significant and needing treatment to where it gets so severe it's impacting our functioning. If you liked this video, please hit like and subscribe. I've got plenty of other videos on teen mental health. In fact, I've got one about teen depression that can go over some similar strategies, but there's some key differences in being able to treat some symptoms of depression. Of course, it manifests itself differently. You can go ahead and find out more when you click the link above. All right, take care. Bye-bye.